Welcome to Uncensored Conservatism, episode 151. Today we're talking about Project 2025 again. What's in it? Chapter 14, part 1. And we're going to do this in 3 parts. So, chapter 14 is about Health and Human Services and was written by this guy, Roger Severino, who formerly worked in that department. If Health and Human Services was a country, given its $1.6 trillion budget, some of it discretionary, some of it not, it would be the 5th largest economy in the world. That's how big it is. It impacts more American lives than any other federal agency. Under Biden, Health and Human Services has transformed into a large diversity, equity, and inclusion experiment. So there's several goals that should guide the department, with the first protecting life, conscience, and body integrity. That means there should be a deep respect for human life from day one to death. No abortion, no euthanasia. It also means that religious freedom and conscience protection laws are upheld and enforced. And it should go without mention by now that body integrity means a rejection of gender ideology that destroys the lives of everyone, but especially minors or children. The second priority is empowering patient choice and autonomy. Prices decrease and quality increases when there is competition, and individuals should make their own healthcare choices. That also applies to doctors. States should regulate the medical profession within their borders without irrational Medicare and Medicaid reimbursement schemes. Project 2025 notes the American insurance system is broken and in need of repair, assuming that healthcare reform is a desired policy because, let's face it, this thing just fucked it up even more. Goal number 3, promotion of stable married families, since families are the foundation of any functional society. So things like LGBTQ equity and single motherhood subsidies and lacking incentives for work all have the effect of retarding stable married families. Policies designed to promote and foster the nuclear family should be pursued, and that includes improvements to our adoption system. And goal number 4 is preparing for the next health emergency, and the centralized approach to the COVID-19 thing was probably the most ridiculous thing I've ever seen in my lifetime. The government's public health apparatus has lost the public's trust. It must be reformed to be more resilient, scientifically grounded, and certainly more efficient. From lockdowns to school closures to vaccine mandates, it was coordinated by a state of emergency declared by the Health and Human Services Secretary. Left unanswered was, what defines an emergency? Is it the number of deaths, hospitalizations, just the number of reported cases? We must know with clarity what constitutes a state of emergency. Never again should little fascists like this gnome have such a great say over responses to a so-called public health crisis. Never should hidden bureaucrats hide important information concerning the dangers of their preferred treatments or the advantages of those they disfavor. Hence, we come to the 5th goal: transparency, accountability, and oversight. That means lessening the influence of pharmaceutical companies, insurance companies, and hospital conglomerates. But notice who's missing here. You, the patient. The National Institutes of Health, the CDC, and the FDA should be free from biopharmaceutical funding, because this is basically corporatism at its worst. The revolving door between government and big pharma, both ways, should be shut, and Project 2025 suggests 15 years is a good start. COVID-19 proved the CDC is probably the most incompetent federal agency. First, masks were not necessary, then they became mandatory. They botched the development of COVID tests. We were told to put our lives on hold for 2 weeks to flatten the curve, and that turned into 2 months. Cost-benefit analysis of CDC guidelines and recommendations are not even a consideration. What is the cost of a lost year of education when schools are closed? How many lives were saved by closing churches? Why was COVID testing so messed up? It was because the CDC's preference for its own in-house test when private industry, not a CDC lab, can do it better, quicker, and likely more cheaper. You can thank the FDA, not the CDC, for that COVID test you still have in your drawer. When responding to a novel pathogen, the CDC should gather and disseminate the information, maybe even the pathogen itself. They get the hell out of the way and let the private sector take over. The CDC is a public health institution. It is not a medical institution. It is not the nation's doctor. Their guidelines are informative. They are not prescriptive. It was in 1992 that the CDC found a loophole in the law that was designed to prevent funding from pharmaceutical companies. Instead, they received those funds through a nonprofit, the CDC Foundation. Almost $80 million in a 4-year period was funneled to the CDC from Big Pharma, and this has got to end. Severino notes, correctly I might add, that abortion is not healthcare. Instead, they need better statistics that compare the relative risks and benefits of childbirth versus abortion. And hundreds, if not thousands, of healthcare professionals have been fired, or they face penalties if they don't toe the abortion line. The CDC must respect these conscientious decisions of doctors. Now, here is something that required a little more research by me. Fertility awareness-based methods of birth control. These are at-home urine tests which measure certain hormones that indicate ovulation and fertile periods so that one can avoid having sex and getting pregnant. Some are 99% effective. Project 2025 says the CDC should examine these products for efficiency and accuracy and then promote them. Instead, the abortion industry incorrectly calls them the rhythm method. If they are, then they are a scientifically based rhythm method. Infant mortality and abortion statistics are woefully lacking and voluntary on the part of many states. Instead, Health and Human Services health funds should be denied to those states that do not report on abortion, and that those statistics should be detailed. The left likes to trot out the worst case scenarios when it comes to abortion. There is no conservative or sane medical practitioner who considers a miscarriage an abortion, and likewise, ectopic pregnancies are a medical emergency, and yes, abortion is the answer in those cases. Project 2025 goes after Big Pharma by noting that 90% of generic drugs cost $20 or less, but that the big companies hold monopolies on certain drugs. As the law stands now, Big Pharma can sit on their legal right to be the first to introduce a generic version of their own drug. The more competition, the greater the reduction in prices. When it comes to medical tests, the FDA and the Centers for Medicaid and Medicare Services claim overlapping duties. This overlapping authority needs to be undone to more quickly develop and bring to market certain tests. Thin profit margins for generic drug manufacturers discourage inventory and lead to drug shortages. Big Pharma should not hold the pharmaceutical gun to the head of the FDA. The FDA currently uses a pass-fail system when inspecting facilities. Instead, they should convert to a grade system for consumer transparency and to assist pharmacists in making necessary decisions. And speaking of drugs, Project 2025 does address abortion pills by noting that since mifepristone was introduced 20 years ago, there have been 26 confirmed deaths, countless hospitalizations, and numerous unreported complications. When originally approved by the FDA 20 years ago, they failed to study the safety concerns associated and have since encouraged receiving these drugs through the mail without ever setting foot in a doctor's office. The Biden administration removed restrictions and encouraged this through the mail method by eliminating the in-office rule for its administration. At a bare minimum, this should be reversed, which suggests some acceptance of medical abortion procedures under certain circumstances. The reason that complications from these pills is underreported is that the woman usually goes to a hospital instead of the prescriber of the pills. Even still, Hospitals do a good job of reporting, but the onus must be shifted to the prescriber of the pills. Unless you think this is a special rule that targets abortion pills, complications from any pharmaceutical must be reported to the FDA. That's how the FDA knows to take a drug off the market or to announce warnings. The FDA has to step in and disapprove the receipt of abortion drugs through the mail, plain and simple. Now, some vaccines are developed through fetal tissue harvesting, which injures the conscience of some people. Japan develops the same vaccines that are equally efficient without using this method. The FDA should waive the restrictions on the bulk import of these drugs, which Biden put into effect. These studies show that about 65% of regulators leave the government and end up working for a company whose drug they regulated. This needs to end. The cozy, incestuous relationship between the FDA and Big Pharma must cease and a cooling off period imposed. In 1997, the FDA relaxed regulations on advertisements of drugs by Big Pharma. The United States and New Zealand are the only countries in the world to allow this. Perhaps it's time to reinstitute the ban on ads. The National Institutes of Health portrayed as a benign research agency when it is anything but. Two areas of concern, animal chimera experiments and gain-of-function research, both need to be unfunded. And it might surprise you to know that adult discarded surgical tissue and adult stem cells have created more advances in medicine than fetal stem cells obtained from elective abortions. There are alternatives to fetal stem cell research, and years of using fetal tissue have resulted in very few advances. It is becoming obsolete. Project 2025 says it should be discontinued, but I have a slightly different view, since even in the best of worlds there will be abortions. In those cases, no matter how rare, fetal tissue could be used, but with restrictions. In 2018, a study by the National Institutes of Health on the positive effects of moderate drinking was funded by the beer and liquor industry to the tune of $100 million. At Fauci's former division with infectious disease, they hold half the patent on the Moderna COVID vaccine. Several employees will receive $150,000 annually. What kind of shit is this? Francis Collins, Anthony Fauci, and Clifford Lane, all on the government payroll, receive royalties from pharmaceutical companies. These people are administrators. They are not co-inventors. From 2010 to 2020, NIH personnel received more than $350 million in royalties from Big Pharma. This is a scam, and it's no wonder the medical community creates so many new maladies to justify the new medications. I mean, come on. Chronic dry eye, restless leg syndrome, you name it. Practically every other country has more stringent restrictions on these conflicts of interest, which is why they had better studies on COVID, natural immunity, and the efficiency of vaccines. The CDC and the NIH foundations need to be jettisoned. Their board of directors are populated by Big Pharma officials. They are funded by private donations from Big Pharma. The NIH got caught up in the Me Too movement and actually refused to sponsor any conference unless there was a certain quota of female panelists. Seriously, they did this. Finally, the NIH has been at the forefront of pushing transgender agenda and ideology by suppressing information detrimental to that ideology and supporting research in favor of the agenda. And we're going to end it there. We'll pick up more of this department in part 2, since there's so much more to discuss given the department's enormous size. Until then, have a great day and a more pleasant tomorrow.